Hello everyone, my name is Rachel Bergen and I'm here presenting to my family on the use of counselling skills. I've been asked to talk to you today about this as part of my diploma in counselling skills. Okay, so this is what I will discuss. I'm going to go on to discuss about qualified counsellors in community outpatient services and in schools. I will then discuss uses of counselling skills in different contexts in schools, so teachers and careers advisors. I will discuss the differences between outpatient counsellors and school counsellors. I'll then discuss the similarities between qualified counsellors and users of counselling skills and the differences between the two. I will then compare this to another presentation that I have received on the use of counselling skills. So firstly, I'll discuss outpatient services. So outpatient counselling services are where qualified counsellors may work to provide care to the community. So I work in an outpatient counselling service, as you know, it's Oakwood Psychology Services, and I will talk about the use of the counselling skills by our qualified counsellors. So at Oakwood we all did the BACP framework for counselling skills to deliver high quality care to our clients. So for those that are unaware of what BACP is, it stands for the British Association for Counselling and Psychotherapy and is an ethical guideline to ensure the best practice. We also received the appropriate training to enhance our skills for working with mentally and physically compromised clients by all going on group courses as a team. The type of counselling skills at Oakwood Psychology Services ranging from one-to-one therapy to supported mealtimes, group counselling and family counselling. So therefore the skills that we actually use will vary depending on the context. So when administering group counselling, counsellors must be aware of the impact that other clients can have on each other. So you have to carefully monitor the conversations and try and guide them and divert them away if they are inappropriate at all. They must also speak to individual clients about their behaviours if it's inappropriate and causing distress to other clients. On the other hand, one-to-one counselling may afford more opportunity to develop a rapport and could be more appropriate for clients who are quieter and don't wish to share their feelings in a group environment. Finally, our group counselling session for families, so that's the families of those who are suffering from the eating disorders, so our clients, enables them a supportive environment for each other, but we do have to ensure confidentiality whereby no references to the client's actual names are permitted in that session. So regarding our referrals, our clients are specifically referred to us under the NHS for the treatment of eating disorders. This can be from inpatient services such as Judah Royal Hospital, or it can be from the GP or other community services. Alternatively, clients can self-refer, but this would have to be for private therapy. So as part of my job, I actually triage our referrals from the NHS. So for example, we can't accept patients under the NHS with a BMI over 40, and therefore I must know how to refer them appropriately to the Choose to Change Weight Specialist programme. Not only this, but eating disorders do carry physical risk to our clients, so we have to be knowledgeable about when we can no longer keep them safe in the community, and those with a BMI less than 14 must be referred on to an inpatient service. So our clients themselves are aged 16 plus, and they do suffer from a variety of mental health conditions, including eating disorders, depression, anxiety, OCD and bereavements. We do offer both NHS and private therapy, whereby only those suffering with eating disorders in Stockport can receive treatment from the NHS. Otherwise, private therapy does cost £50 per session, which lasts approximately 50 minutes. So aside from dedicated outpatient counselling services, other contexts such as schools will also have qualified school counsellors. Not only this, but they do have other career roles that will benefit from the use of counselling skills. So this could include careers advisors and teachers. This means that they can use their skills for understanding the clients or pupils in this case that they'll be working with. So firstly, I'll discuss the clients for student counsellors. They'll be aged 5 to 18 years old, and whilst they may be struggling with mental health conditions that I've described at Oakwood Psychology Services, they are less likely to have specific diagnoses. This is because, for instance, a child who's aged 6 might not have had the diagnostic checks to diagnose them basically with a mental disorder per se. So they may come with issues such as bullying or sexuality or family problems. Regarding referral, the school setting is accountable to the parents, so the school can't refer a child for counselling without parental consent. Teachers may also refer students for help if they feel that they can't cope in the classroom with providing them help, and they could benefit from further help. Good communication between counsellors and teachers is therefore paramount to ensure the child's well-being both academically and mentally. It's also useful when scheduling counselling sessions so that classes are less disrupted. So school counsellors must also communicate with other specialist services and make appropriate referrals. Alternatively, teachers and careers advisors could benefit from the use of counselling skills. So teachers must understand the needs of all their pupils. They should provide extra help to those who need it in the classroom. So this could be someone with special needs, ADHD, or autism or anything of that nature. The school might also actually employ an individual that's specifically trained in this area to provide one-to-one learning support in the classroom. They must also communicate the needs appropriately to parents at parents' evening, so a teacher would have to use some of the counselling skills such as empathy and active listening to communicate with students' parents. Careers advisors may also use counselling skills to actively listen to older students regarding their career choices. So in this sense, they can discuss the students' specific needs and their personality traits and interests to guide them down the correct career path for them. Here, the advisor can help clients and they can help them focus on the solutions rather than the problems. So a client might not think they're good enough to do a specific career, and the careers advisor can then give them tips and tricks on how they can apply and get into the career that they would like to get into. I will now discuss the differences between outpatient counsellors and school counsellors. So as mentioned, Oakwood accept clients aged 16 plus, whereas school counsellors may be working with children from a wider age range from 5 to 18-year-olds. At Oakwood, our clients are given 50 minutes on a weekly basis. This is the same time slot each week, but most children can only concentrate for 30 minutes. So there may be shorter sessions, and they may also benefit from having their counselling sessions around the school timetable. So if it's a 2-weekly timetable, they might not actually have a weekly session, or it might change for every week. There are different safeguarding concerns for children as well, so services could be alerted if they are at risk under the caregivers, whereas for adults, whilst it could be safeguarding issues due to caregivers, it could be more likely their partner who might be abusing them or something of that nature, because they are less likely to still be living with their parents. Again, as mentioned, at Oakwood we do accept private referrals, whereas a school environment would probably be more free sessions, just as part of what the school provides for the clients. So I will now discuss the similarities between qualified counsellors and users of counselling skills. So qualified counsellors and users of counselling skills must all demonstrate the following skills, which you can see on the slide. This includes active listening, empathy, non-verbal communication, paraphrasing and summarising. So counsellors must be empathic to their students as well as to the teachers working with these students. So if a teacher comes to a counsellor with a specific problem, they should then try and provide a solution and not look down on the teacher for not coping with this problem or whatever. They should display empathy to the teacher as well. By ensuring that they are empathic, teachers can also help the children themselves. For instance, a child may be in a damaging home environment with no one to talk to about this. If they feel they can talk to a teacher, the teacher themselves could help, or they could help encourage them to the right person to provide what they need the help for. So by responding comfortably to the students as well, it could give the student more confidence to go and seek help elsewhere because they've already spoken to someone about the problem. Parallels can also occur with careers advisors, where they aim to give a client a greater sense of control amidst the complexity of life development, which is what a counsellor is there to do really as well. Continuing on, like trained counsellors, users of counselling skills must understand the limits of their help and refer the students on when necessary. So I mentioned Oakwood Psychology Services, we do have inappropriate referrals which we do refer on. Careers advisors may also need to refer to another professional. For example, a student's career path could be complicated by financial issues or other problems, and a careers advisor would need to try and help solve them problems before they can then go along the right career path for them. So users of counselling skills can also work with qualified counsellors, as mentioned. Teachers can work with school counsellors to provide the best care to the community. Parallels to counselling approaches such themselves also occur, so cognitive behavioural therapy. A teacher who is disciplining a child who reacts aggressively to another can sit down with that child and explore what happened before the event and how the child can perhaps respond differently next time. So that's quite similar to the use of CBT in a counselling setting. And finally, similar to counsellors, teachers and careers advisors must always prioritise self-care. They need to avoid burnout so that they can provide the best care to the students possible. I'll now discuss the differences between qualified counsellors and users of counselling skills. So the main difference is that qualified counsellors are bound by a code of ethics and professional responsibilities, which is usually the BACP, which I mentioned before. In contrast, an individual using counselling skills can be working in various different contexts, so they may be abiding by their employer's framework. So this could be, for instance, nurses could be abiding by what's called the College of Nurses of Ontario, or social workers may be abiding by the British Association for Social Work. Counsellors will also have more extensive training on the different problems that clients may seek help for, whereas users of counselling skills may then use that to refer the particularly challenging cases. So as part of this course, I must also compare my presentation to one that I have received. So I have actually received a presentation at work about users of counselling skills, and it had a focus on volunteers. So whilst we did discuss some information which I have included in this PowerPoint already, it did focus more so on volunteers, both volunteer counsellors and volunteer users of counselling skills. So I basically learnt the following from the presentation that I was given. So despite the fact that volunteers don't get paid, it's really important that they are treated the same as paid professionals and they're taught the use of counselling skills. This will ensure that they do help the organisation to the best that they can, and again, it's always about maximising the client's needs. Volunteer counsellors themselves must be committed to the job, since they do have a duty of care to the client, so they can't just leave and then leave the clients with no one to be seeing them, because it's a bad ending is really detrimental to a client. They must also have access to supervision or someone who they can talk to about tricky cases, because if they're left to their own devices, it can have a real impact on them, which could also affect their work and home life. And as users of counselling skills, they must all be DBS checked just to ensure safety to the clients. So yeah, whilst my presentation has focused on a variety of things such as the context itself, how referrals are made, the clients it sees in that context, this presentation did concentrate more on the well-being of the volunteer counsellor and making sure that they feel like their skills are being maximised and used and they're given respect. Okay, has anyone got any questions at all? I'll just summarise and then you can always ask more questions after. So As discussed, counselling skills are used in various different contexts, including paid individuals and volunteers. For example, counsellors and school counsellors, as well as those using counselling skills in schools, such as teachers and career advisors. What is of most importance after discussing all of this, I believe, is that the aforementioned core counselling skills are used, so that's active listening, empathy, summarising, whilst communication between the services is really important to ensure the best care provided. So that's my main conclusion from the slides. If anyone has any questions, please do ask now. No questions? Okay then, thank you very much for listening. Here's just the references that I've used for the PowerPoint, and if you do have any questions, don't hesitate to ask me. Thank you.